most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today our title is Bob and Brad's Stretching Program for Hip Pain. It's actually based on the Mckenzie Approach.
Right, Robin Mckenzie.
Right, he was a brilliant therapist. You should check out his book, Treat Your Own Hip. This isn't it, but it looks just like this.
Right.
And they're what, about $10,
Yeah,
Brad?
he has a whole series of hip, knee,
Yeah,
back,
yep.
neck.
And they're awesome. He's had a great influence on us. So, all right, if your hips are extremely painful and like any movement at all hurts it, then you probably should watch our video, How to Treat a Recent Injury to Your Hip. Even if your hip pain is chronic, we go over some things just to try to calm the hip down, hip pain down.
It might be good to mention that this is all part of the series.
Yes, this is part of a series of programs, a series of videos on the hip pain. So you go to bobandbrad.com, go to the program section, and you will find one on hip pain, and check that out. We got, 40 videos.
We don't count, Bob, but
yeah, right.
they're all there, and you can go through, pick out the title you want. They're typically 10 minutes long, and it will go specifically to the information you need.
Right, and there's a PDF that'll be supplied along with it.
You print it out, and it's a great way to...
All free, no email needed.
That's
all right,
great.
let's get started, Brad. So you're going to start off. These are the exercises. Exercise number 1, it's a hip flexor stretch. Now, you can do that in the bed, or you can also do it on the floor. Brad, do you want to show the bed?
Sure.
And I'll show the floor.
All right.
I'll give you a pillow even, Brad.
All right, here we go. We'll put it here. Just a single knee to chest, I'm assuming we're doing, right, Bob?
No, your hip flexor stretch off the bed.
The hip flexor. I was thinking flex the hip.
Yeah, you're going to be doing that one too, bud.
Oh, so you move your body to the side of the bed, but your shoulders must stay on.
You're treating the hip flexor, which is, like Brad always says, if you put your hand in your pocket, that's about where the hip flexor is.
Right there.
So you can bring this leg up and stabilize the pelvis if you want.
Yep.
And you can watch what his leg does when he pulls it up. Yep, see? You can see his hip flexor is a little bit tight.
Yep.
Nothing too bad, but you can see that that's going to allow it to stretch. I want you to do this, what we do is usually pressure on, pressure off,
Yep.
10 times. So pressure on, pressure off.
You can hold here and pull like this. You'll feel the stretch.
Now, with all these stretches, this is a little onerous, but you like that word?
Onerous.
Yeah, you have to do these 4 to 6 times a day. That's the key to this, is that a lot of repetition makes it more effective.
Right. And once you get it stretched out and things are better,
Right. Then you can
off.
go to a maintenance program. But I'll show you the stretch on the floor.
Oh, yes.
So basically, I put a pillow down just because I got old knees. But we're stretching the hip flexor here, keeping good posture. I'm going to lean forward. I can even take my hand and push it on my pelvis if I like. And you can also turn your foot out a little bit.
So right here, the foot goes this direction.
And that just puts a little more stretch on it.
Yep, it's one of those tricky little things.
So again, pressure on, pressure off. Pressure on, pressure off.
While you're laying down or kneeling, remember you're going to relax and breathe.
Yeah,
Your stretches
always
go much
breathe.
better.
All right, the next one, Brad, is the one you were trying to do first.
Oh, yeah.
So if this one is starting to feel pretty good now, you can go ahead and start the number 2 stretch. You may want to just do the first stretch for a while and until that one starts to stretch out a little bit, and then start with this one.
So you mean like 10 minutes or a few days?
Few days.
Few days.
Yeah.
All right. So this one, pull up the knee.
Yep.
You know what you could do, Bob? That purple strap over there. You don't have you could show them how to use a you can use a belt. You can use a strap like this. You can roll up a towel. These actually, the more I use these loop straps, the happier I am with them, Bob.
You're finding more uses for them, huh?
Yep. So you can pull like this. Underneath the knee works well depending on your knee. Some people, if they have a knee replacement, their knees don't bend real well, so you reach underneath and then some more comfortable on
And
that.
some people have trouble even reaching their legs like that, Brad.
Exactly.
So it's not unusual to.
Yep, exactly.
All right, I'm going to show you a chair version of this too. So, not two, I guess this is the first chair version. You're going to slide forward a little bit in your chair to the butt at the end of the seat pan here.
Yeah, it's one of the few times we promote poor
Yeah.
posture.
Well, I'm still staying straight.
Okay.
And then you're going to go ahead and pull up like this, and you can just do the pressure on, pressure off, pressure on,
Relax.
pressure off, pressure on, pressure off.
And you probably will find one hip tighter than the other or more painful, and that's your painful side.
Yeah,
so
I
you-
actually feel it on this one.
yeah. It's just the way
Yeah.
life is.
All right, next one is hip external rotation. Brad, do you want to show that in bed?
Oh,
The
absolutely.
figure 4?
I'm happy to do anything lying down. The figure 4 with the legs straight and
Yep.
doing this. We don't need the strap for this one. So you can do the pressure on. This one, I actually let gravity work, and you can leave it hang there.
Yeah, and that might be enough even.
And my hip has got pretty good range of motion in this direction.
It does, yeah.
Some people may have even a hard time getting their foot over
Right,
the knee.
right.
And it may be down here, or it may be way up here, and then your other leg does drop down. So, you can compare one side to the other and work them accordingly. If one's more tight, you're going to spend a little more time on it. You can do it with this knee comes up, and then here, you can hold here. You can do a little
Yep.
pressure here. This really, I've had a lot of people do this one, and they typically feel comfortable with it. People who are really flexible or kind of at that higher end range, you can start to do this.
Pull it up even higher.
That's for the younger crowd possibly, or the active crowd. You'll know. One side may not be able to do this. The other side might. You might be down on this on an injured side or arthritic side.
Now, obviously, if you've had a hip replacement, you're not going to do any of these.
Good point, Bob.
All right, so we're going to cross over. Same thing here, basically. And what's nice about this, well, some people can't do this either. You just had a patient, right? That could
Yeah,
do this.
I think he's able to do it now. I've got to get back with him.
Sure.
But at one point he could not.
So it's the same thing here. Is your basically? I probably should show this way.
Sure.
You're doing the pressure on, pressure off. Keep good posture.
Yes.
But you can actually lean forward and cause a little stretch that way
a
too.
little more. Mm-hmm.
But I'll get a little more leverage by putting it on the ankle there. Again, 10 times. You're going to do the pressure on, pressure off.
Yep.
All 3 of these, 4 to 6 times a day.
Right.
Now, if one kind of gets stretched out, you can maybe do that one time a day. But if it's tight, you certainly want to hit the 4 to 6. Because
Yeah. And I tell you, I just do a maintenance, but like this morning, I put my socks on, I
Give
do
her a
my
stretch.
Do the other one. It's just part of the day.
Right. You can incorporate it very easily. So now the key to this is that we have found is that when your hip gains motion, the pain levels tend to go down. I probably should have said that right away, Brad, so people would be motivated to do the exercises. But check it out. Give it a try. Either way, you're going to gain motion. There's nothing wrong with that.
Right.
So,
Exactly. So
all right. Thanks for watching.
take care.